Hello and welcome to another Facebook Live with Advanced Pain Care. We are joined today with our founder and president, Dr. Mark Malone, board certified anesthesiologist and pain management physician, Dr. Bradley Wisler, and our patient ambassador, Chester Jones.
Hello.
Hi guys.
Hello.
Hi. So with November wrapping up and having just celebrated Veterans Day, I'd love to acknowledge and thank both Dr. Wisler and Chester for your service. Could you each tell us a little bit about which branch you served in and your duties? Chester, we'll start with you.
Of course, I was in the Army for 24 years, 3 months, 13 days, but I wasn't counting. First 18 years was infantry, airborne, air assault, multiple combat tours, and then the last 6 were supply. My MOS had to be changed because of my back, and I just enjoyed it a lot.
Excellent. Thank you for your service, Chester.
Thank you. Yeah, I was in the Air Force. I was in the Air Force for 4 years, not quite as long as Chester, but enjoyed my time with them, certainly. I did 2 jobs while I was with the Air Force. I did anesthesia, I was an anesthesiologist, and pain management. I deployed to Iraq 1 time, and I did trauma anesthesia while I was out there, doing some good work. The rest of my time was mainly doing pain management, just exactly what I do here. And I enjoyed my time while I was there, and I think I did some good work.
Well, thank you for your service.
Thank you for your service, Brad.
Thanks.
Dr. Malone, could you talk a little bit about the treatment we offer to our veterans and any nonprofits you're affiliated with?
Yes, Sam, thank you. We focus on our veterans. Our veterans need a lot of our services, and we're very glad to be of assistance to our veterans. We work with a number of nonprofits here in the Round Rock and Greater Austin area, including the Samaritan Center, and I'm on the advisory board for this. We're with AMVETS, American Veterans. We're with Veterans Crisis Line. We do House Our Veterans, Red, White, and Blues 512, Department of Veterans Affairs, Hope for Heroes, Texas Veterans Commission, and the Housing Heroes Fund. So all of these charities and organizations we do help support in order to help our veterans and get them to the finish line.
So Chester, you actually mentioned your role switching because of your back. Could you tell us a little bit about what you experienced and how that led you to us and being a patient ambassador for us?
Well, as far as my back being injured, of course, as Dr. Wisler knows, you carry a lot of weight on your back, being airborne, being air assault, infantry. A lot of injuries to my back, decompression or compression and just bulging disc, all kind of stuff. And so they deemed me unfit for infantry. No more having fun going out in the woods. And they said that if they were going to keep me, they were going to have to change my job. So when they changed my MOS over to supply, that's when the little spiral for depression began. However, once I got out, they allowed me to find someone to come see. And so through various research and talking to people, that's when I found Advanced Pain Care. Advanced Pain Care told me, we have this thing called a spinal cord stimulator. Okay, well, I'll tell you what, let's give it a try. And so Dr. Malone took me in there and we did a trial. The trial worked. No more pain. I said, oh shoot. So then we turned around and we did the permanent. And the permanent, I now run, I walk, I've got that dune buggy I still like riding on. If you name it, I can do it now. And so then I began talking to patients that we have, and it just progressed into the role of patient ambassador.
That's great. That's a great story, Chester. So after many years of jumping out of airplanes, carrying heavy loads, fighting in the infantry,
yes.
you came down with a pretty severe back injury,
yes.
right?
Yes.
And what happened? Was it a broken back, or did you need surgery, or just exactly what happened to your back?
Well, I did need surgery. However, the disc decompression, and there was something else that they had done.
A fusion, maybe?
They wanted to do a fusion, but I'll be honest, I was scared.
Good for you.
Yeah, exactly. And so therefore, I just didn't want to try anything of that nature, so invasive. And then I remember when you told me that the spinal cord stimulator wasn't that invasive and that it could help me decrease my opioids.
Yeah.
which I was taking like 4 to 5 times a day.
Yeah.
It was a combination of Percocet and morphine. I mean, that stuff, to be on that for years.
You were on this for years.
Yes,
And
multitudes.
And that's depressing in itself, right?
Correct.
Taking heavy doses of pain medicine.
Mhm.
It takes your energy, it takes your ability to get up and go.
Yes.
So you were basically living on the couch.
Yes.
Or in bed.
It was either in the bed, on the couch, walking with a walker, having my wife or my youngest son help me around.
Right.
Wasn't going to church. So I would have to leave work early or either be stuck on
Yeah.
the meds at work.
Yeah. So pretty bad disability. And at the young age of what, 40?
Yes.
45, something like that.
Mhm.
Yeah.
Yes.
So pretty bad situation. And then we finally decided that the stimulator.
Yes.
All right.
Yes.
Good.
And one thing that my wife did say, she was like, okay, I'm glad that you finally got that. What I didn't know, I like to have fun, I like to joke around, have a good time, but I didn't know that it was making me mean.
Yeah.
And of course, pain can make you mean, but
Right.
I wouldn't realize it. So after I got it, she in turn said, I'm glad you got it because I was going to knock you out otherwise.
Oh my God.
Yeah.
That's crazy.
And then she turned around and she had her trial for hers about 2.5 weeks ago.
Yeah.
And she said 100% pain relief.
Wow.
What happened to your wife that she needed a trial?
20-something years ago, she fell down a flight of stairs.
Oh.
And it progressed to where she had a torn tendon, a ruptured tendon, and they ended up having to cut part of the heel, fuse part of the ankle, put a bolt and a screw in her foot, and
So messed up her ankle, falling
Yes.
down a flight of stairs, ended up with several ankle and foot surgeries,
Yes.
which is a tough thing to do
Mhm.
over a period of years,
yes,
right? So she was pretty messed up too.
Yes.
Pretty bad ankle, pretty bad foot. Could she walk at all on this ankle and foot?
not well,
No.
not well at all. When it come time to like chase the grandbabies, she
Yeah.
couldn't do that.
Yeah.
Or I would pick at her
Yeah.
to make her chase me.
Yeah.
She couldn't chase me.
Oh, Lord. And swelling too. She had some ankle swelling, foot
Yes,
swelling.
I'm gonna say 3 to 4 times the normal size. It would literally actually swell
Oh
up.
my God. So all, nerve damage, vascular damage, all of that will cause ankle swelling.
Mhm.
And so that's just disabling too.
Yes.
Right.
Oh yes.
When she got the stimulator, did that go away?
Oh my gosh. Okay, not only did the swelling go away, but before we got home, which was probably about a 25-minute drive, she was trying to dance in the truck.
Oh my God.
And she was, I'm not kidding, she was trying to dance in the truck. And then for that week that she had it, she was just elated. She was so happy.
Wow.
Her ankle did not swell up anymore. And she was, chasing the grandbabies.
No, that's amazing.
And it was awesome.
And now she has the permanent implant.
That's what we're waiting on right now.
Oh, we're waiting on that.
Yes,
Okay,
that's
so
what-
she's right in between.
Yes.
When do we get the permanent implant?
Just waiting.
Any day now.
Any day.
All right. Well, let's
Yes.
do it.
It's amazing.
So for anyone that might be watching, hearing Chester's story and relating to it, Dr. Wisler, what advice would you give them if they're considering going this route? If they're relating to Chester, what would be the indicators to you to kind of point them in that direction?
Well, talk about the indicators, but I think just reflect on what Chester just mentioned and how it's changed his life and his wife's life. I mean, he had commented on how he didn't realize the pain was making him grumpy, and
Yes.
maybe to put it lightly, probably, and his wife wasn't dancing or doing anything
Right.
like that, and to look at where you're about to be, you got your sense of humor back, you're happy, you are enjoying life,
Oh, yes.
and your wife is about to be dancing again. Like that turnaround is just incredible, right? Like
That's
that is
pretty amazing.
That is literally
Pretty amazing.
life changing.
Yeah.
And so I look at my patients and I try to identify these areas where they're struggling in their day-to-day life or with their families, with what's meaningful to them, and I try to get them to really acknowledge how limited they are in these things that they want to do or like to do.
Yes.
And I try to say, hey, this could really turn around for you. I try to paint that picture for everyone and try to realize that you don't have to live like that. That's the goal. That's what I try to get them to understand. But then it has to be the right thing for them. They have to have the right condition and the right issue, the right pathology, which you did, your wife did, and so of course I'll identify those for the patient as well.
In the Air Force, Dr. Wisler, did you see a lot of soldiers that needed a stimulator?
Absolutely. I mean, Chester, you commented on it right there, jumping in and out of airplanes all the time. The life of a military member is very, very, very traumatic. You know, we're running and jumping out of planes, getting shot at, rumbling, tumbling, blown up.
Yeah.
Lots of spine, back, neck, leg issues. These are, you know, severe enough. These are clear indications for a spinal cord stimulator. So in my time in the military, I saw this repeatedly.
A lot of nerve damage.
A lot of nerve damage.
Yeah.
But it doesn't end with the patients in their time in the military, right? It
Right.
keeps going and going. They live with this. And so for all the veterans, you know, this is certainly still applicable to them now.
Absolutely.
Yeah, definitely.
So guys, I'm just going to chime in here because we're getting a lot of questions about the spinal cord stimulator. Dr. Malone, is there any like requirement for an amount of surgeries or failed surgeries that you have to have before you'd be willing to do a trial for a patient?
Not necessarily a requirement. We do see a lot of failed back surgery, which is a good indication for a stimulator. Many times the patient has had surgery to try to fix where the pain is coming from. Sometimes that's effective, many times it is not effective because the patient is suffering from nerve damage and you can't fix that with surgery. Right, Dr. Wisler?
Right.
So what it comes down to is how do you treat this nerve damage? Well, one way is to try to cover it up with pain medicine, and that's about 50-50 helpful. It does help to take the edge off to take pain medicine, but it's no fix, and you have to take it forever. And like Chester has touched on, there's side effects. You know, your personality changes, your energy changes. A stimulator is a modern technique to block the pain signals from reaching the brain. So just like a cardiac pacemaker can affect the heart's rhythm, the stimulator can affect the way pain signals are perceived in the brain. So it's a modern way to block those pain signals without chemicals, without changing your lifestyle, and it's highly effective.
Sure.
What is the life of a spinal cord stimulator? Is this something that's going to have to be changed out? Like, what is that going to look like for your patient?
That's a great question, Sam. The modern batteries today that are implanted are good for around 8 years or so. Would you say, Dr. Wisler?
Yeah, definitely agree.
So after 8 years, if you still need the stimulator, and not everybody does, but if you still need the stimulator after a period of 8 years, we can replace that with a simple outpatient procedure.
Dr. Wisler, if you have a patient that comes in and maybe they have an old stimulator, what can we do as a company to help manage maybe an old device, and how do we keep the ones we implant, how do we keep those fine-tuned?
It's a great question, Sam. If someone already has a stimulator coming in and they're still having pain or they're still having any kind of issues or no pain at all and just need some maintenance, we have a very, very big group here, a very big practice, and we have a lot of resources. We work very closely with the spinal cord stimulator teams, the actual device companies, and they have representatives for those teams that help reprogram the devices. So I try to relate to our patients kind of like an old computer. Sometimes you just need to turn the computer on and off, or you need to download new software. It's very similar to that, or even like the new phones right now, right? You just need to download a new app or restart your phone. It's often just as easy as that. And so we have those resources here. It's very, very easy to do. We get them in very quickly to do it. And so if you have a stimulator and you need titration or need help with it, definitely come here and we can help you out.
Chester, I've got a question that's coming for you. For an active service member right now that might be watching, would a spinal cord stimulator be something that you would recommend? Does it mean that you have to be in retirement and rolling around in bed feeling like your quality of life has gone down the toilet? Or can you be an active member and still feel like, yeah, that's a route I could take?
You could be an active member and still desire to have a stimulator. The only thing is, as we were discussing prior, rules and regulations, the deployability issue is the primary thing. I think you may know more about that.
It's a great question. Whoever asked us, we were literally just talking about it maybe 20 minutes ago. And I probably do know a little bit more about this because my time recently in the military, I was actually implanting and putting these into members. And so unfortunately right now, the way that it is if you're going to get a stimulator, right now the rules are you're non-deployable. And so we know, right now the limitations, if you can't deploy, then you're probably not going to be in the military for much longer. So right now, if you get a stimulator, you're probably going to be on your way out. That being said, if you need the stimulator, you need the stimulator. If you need the stimulator because your pain is so bad for various reasons, your deployability is probably not going to be that high anyway. So if you need it, definitely seek it out. This is something that we can put in while you're active duty on your way out. And that'd be preferable to me to have it put in while I'm still in. But even if you don't get it in and you end up completing your time and it's still something for you, you can absolutely have this put in at any time afterwards.
Right, and probably if you have severe chronic pain, you're probably not deployable.
Correct.
Right?
It's difficult to do that.
Yeah.
It's certainly going to be limiting.
Right.
Yeah.
Right. So, like any implant, like if you got a pacemaker for your heart, you probably wouldn't be deployable.
Right.
Or even a total knee replacement, you probably wouldn't be deployable at that point.
Typically, I don't know. That's a little bit less common to see a total knee replacement in someone who's still active duty.
Yeah.
But I think that one could slide. You could probably have total knee, and if you're functional, you could deploy. But
Jump out of an airplane.
yeah, it might not be the best. I think if you're having a knee replacement,
You probably don't want to jump.
Yeah.
Yeah, your days are airborne.
Yeah, you're probably full bird colonel, not getting deployed in there.
Oh,
Something
right.
like that.
Dr. Malone, do we have any issues getting those covered once someone has gone into the retirement phase? Are there any limitations on that front for our retired veterans to get that covered and be able to do that trial?
Absolutely not, Sam. That's a great question. Insurance covers this across the board. The military insurance covers it, TRICARE, TriWest, Medicare, all of them, Blue Cross, United Healthcare, they all cover spinal stimulation. In fact, they really like it. The insurer company really does like the stimulator because it's shown to be less expensive over time than chronic pain medication.
Dr. Wisler, we had a question come in about what the surgical piece looks for the spinal cord stimulator implantation. And Chester mentioned a trial. Could you walk us through what that looks like once it's identified to like, we're good, we're doing it, and here's your new life? Tell us that process.
Sure. We like to kind of describe it as being two separate parts. Two parts to getting a stimulator put in. One is a test trial, and the second one is where you do an implantation. So the first part, the test trial, I think is most critical to describing to patients because at this point a lot of the patients that are leading towards this or getting near the time for this, they're very hesitant as is. Maybe they've already had back surgery before, they've had 20, 30 whatsoever injections, they've been treated on with lots of different ways. They don't want any more stuff done. They just they're a little bit hesitant sometimes. And certainly hesitant to have another back surgery or back procedure. So I look at it and I try to explain to them that the test trial is not a back surgery, it's not a back procedure, it is a regular injection, right? If most of them have had epidural steroid injections or some kind of injection to the back, it's really no different than that. We put the needle into the same place, but instead of injecting a medication, we slide these wires up into the back. We take the needle out and everything is taped up on their back. They go home for a period of 3, 5, sometimes 7 days, and they get to test it out. At the end of the test period, they come back to us. We take the wire out. It's just like taking a Band-Aid off. It's very easy. And then they tell us. They tell us whether it worked or it didn't work. It's as simple as that. They say, the medications work just the same. It's okay, right? Didn't really get much relief. Or they tell us, that was fantastic. I got my sense of humor back, or I was dancing this week. This week was what I've been wanting for years and years. So that's a very critical part, that test period. The second part is the implantation. It's usually about a month or so later when we do the implantation. And the way I describe it, I still don't even like to consider it, really talk about it as a back surgery. I still like to say, it's a very minor back procedure. Back surgery, when people usually think of that, they're talking about the fusions and the decompressions and actually working down around the spine. When we do these stimulators, it's not that deep. It's not around the spine. It's a very superficial procedure, and so you have two very small incisions. Sometimes people just do it in one, but very small incisions. It's a very easy same-day procedure, very quick recovery, and that's how I try to explain it.
So, Dr. Wisler, how many of these trials or test drives are successful?
What are our numbers here? How are you describing that?
I'm telling people about 90%.
Yeah.
90% of them say that they have greater than 50% relief. Many of them are getting 80 or 90% relief.
Yeah, that's about what I see too. And historically, we used to say we want 50% or greater. But nowadays, we're really trying to shoot for that 80% or greater relief. And I really do find that when we identify the right patient for this, it's the right patient. This is definitely going to be the right procedure for them.
Right.
We're really going to be approaching that 80, 90, almost 100% relief.
Right. The key is that once you experience the pain relief in your trial, you'll be sold on it.
Yeah,
right? Because
absolutely.
It's like nothing else. It's almost like the injury never happened.
Yeah.
Right? So that's the beauty of it.
Guys, we're actually at our 5-minute wrap up. Is there anything else each of you would like to add? And Dr. Malone, I would love for you just to say a couple quick things about all of the other service lines we have here at Advanced Pain Care.
Yeah. Well, I'd love to, Sam, and thank you. One thing I wanted to mention is I'm a stimulator patient as
Yes.
well. Shortly after I helped Chester get his stimulator, he had such success that I said, well, dang it, it's time for me to get mine too. And so I had mine like a month after Chester did, and it's a brilliant success. I have no more back pain. Before this, I had some severe pains, probably worse than you if I had,
Yes.
because I was in bed all day and really suffering. I mean, I really was. And I know what that looks like because I've been a pain doctor for 20 years or more. So I'm really happy to be the poster boy for spinal stimulation. I have one. I use it 24/7, and it works great. Going forward, though, spinal stimulation is part of the picture. We try to do everything for chronic pain, including neurosurgery. We have neurosurgeons on staff. If there's spinal disease that needs to be addressed, then neurosurgeons can definitely evaluate and manage that. We have orthopedic surgeons on staff that can take care of your bones and joints, because many times chronic pain involves bones and joints. We have a rheumatologist on staff because many times rheumatology is a big part of chronic pain, and so we have so many patients that need to see a rheumatologist. We even have addictionology services on staff because many patients are on chronic pain medicine. They've been on it for years. It's hard to get off of it, and sometimes abuse is a problem. So we have all these services right here under the same roof. We freely communicate with all the specialties, and that's what I think makes us special.
Anything else, Dr. Wisler, you'd like to add?
Yeah, just one more time, comments for our veterans or any active duty folks who are living with chronic pain and living with these conditions. This device, this procedure is truly life-changing for many, many, many people. And so it doesn't always have to be like that. So let us know how we can help. We're always here for them. That's my piece.
Chester, I did want to throw in for you. You are available on our Facebook page. You have your own Ask a Stimulator forum, and that's where people can get you directly and get your opinion and get your advice, right?
Yes.
Yeah.
Yes, they can do that, as well as they can always give me a call. And
So if somebody calls up to Advanced Pain Care and they say, get me on the phone with Chester Jones, that's going to happen.
yes,
Wonderful.
yes, that easy.
All right, guys. Well, that's all the time we have for today. Thank you, doctors, and thank you to everyone that tuned in and participated. If there are any questions we didn't get to answer, we will be responding back in the comment section. Y'all all have a good week, and as always, at Advanced Pain Care, the pain stops here.